Welcome, everyone, and thank you for joining us. This month is all about breast cancer awareness, and today's conversation we're speaking with Meg Alpha, who is a nurse practitioner and fellow cyclist. Meagan has been in practice for over 8 years, and she recently opened her own private practice, Alpha Women's Wellness, in Argyle, Texas. She also competes on a state and national level, most recently winning the Category 1 cross-country state championship title in 2022. She has a great passion for cycling and women's healthcare, and Meagan feels it is a blessing and a privilege to be a part of women's healthcare, delivering individualized, compassionate, and empathetic care while developing a supportive and trusting relationship with their patients. Welcome, Meagan. Thank you so much for being here today.
Hi, thank you so much for having me. I'm definitely looking forward to talking about this subject and, getting more information out there to women.
Yes. So speaking of information, okay, I'm going to keep this very broad. What's the first thing I need to consider when thinking about being a woman, thinking about the idea of breast cancer? Where do I start?
Yeah, so a lot of times for women that come in, if you're not having a high family history of breast cancer, a lot of women will start screening as far as mammograms or thermography around age 35 or 40. So that's kind of the guidelines, is around 35 or 40. However, if you have a strong family history of breast cancer, you may need to get screened even earlier than that. So that's something to talk to your provider, whether it be your primary care doctor or your OB-GYN or your nurse practitioner, and talk to them about that. Usually it's 10 years younger than the youngest relative that was diagnosed.
So give me a number. So let's say I had a family member that was diagnosed. I'm roughly just throwing out numbers at 45. So 35 would be the number that I'd need to consider doing testing?
Yes. So a lot of women will have their first screening, like imaging, around that time. Of course, when you go into your physician or your nurse practitioner, you're getting annual. So once a year, you should be having like what we call a clinical breast exam, where your practitioner is actually doing a physical exam as well on the breast. And then, of course, women should be doing once monthly self-breast exams. Yes. And you want to start way up in the armpit, because you have breast tissue that goes way up in the tissue. Mm-hmm.
Yeah, I think I've made that mistake where I've just focused in this area and not thought to come up in here. And I think I shared with you separately, like because it's Breast Cancer Awareness Month and I haven't done them like I should. I've been checking. I know you told me, you're like, don't do it every day.
Don't do it every day.
But I'm definitely more mindful of it now. Can you tell me a little bit about, with the screening and the different genetic or hereditary testing, can you tell me about what that process is like, what it's testing for, and how I actually go about getting tested?
Right. Yeah. So at my office, I offer genetic testing through a lab called Myriad, and I've been with them for well over 3 years now. And basically, if you have a high risk cancer, family cancer history, you may qualify for this screening. If you have insurance, it's usually covered 100% by your insurance. It's also, they offer a very low self-pay cost. That cost can change, so we just find out that cost at the time. But basically, there's a quick questionnaire that you can fill out, and it'll tell you if you qualify or not. So the basics is, if any close relative under the age of 50, female under the age of 50 has breast cancer, you'll qualify. Any male breast cancer in the family, you qualify. Or if you have like 3 family relatives over the age of 50 on one side of the family, you qualify. So there's a lot of little things that, could possibly qualify you for screening. And it's a simple blood draw.
Yeah. Now, I know it's Breast Cancer Awareness Month and we want to focus on that, but are there other types of screening or testing that that's available for other cancers potentially?
So this Myriad test also for any ovarian cancer in the family, you'll qualify, pancreatic cancer, some uterine cancer, colon cancer. There can be age specifics to that as well. Yeah. Like I said, it's a very simple, link that you can just take real quick, and it'll let you know if you qualify or not. So But there's a lot of cancers out there that are hereditary. And so it's pretty amazing that we have this ability to know if our genes have that change to them that puts you at a higher risk.
Yeah. Yeah. Now, I think I asked you about this before, but could you give some advice because if I'm being honest, I'm not 100% familiar with my family history. I know there's certain family members I know that have been diagnosed with different cancers, but I don't know all of it. Like, what's some advice you can give for how to have those conversations or how to uncover that information?
Yeah, I usually encourage patients to just go talk to mom, sister, or aunt, grandma, any of the relatives that may cover that family history. I think at a certain age, we start wondering, hey, I wonder, if I have this in my family, cancers, but other things too. So I feel like more women are proactive on finding that information out. And so it just simply comes down to, just asking your relatives. And the thing about this also is a lot of times with Myriad, with this lab, if I have a patient, say, with a higher gene, they make sure to offer it to all family members that also qualify. So, I will also screen men or, other family members. I've had a group of 5 sisters come in just for the screening before. So it's definitely something that, talk to your family and say, hey, we've got this in our family. There is a screening out there, and then if it does come back positive, then, you can educate your family. It's all about that education on, hey, we do have this higher risk. So maybe we should, think about what we want to do in the future.
Yeah. So if through my screening, there's a percentage that I definitely want to be cautious of, I can encourage my son or my daughter to then also come and get screened as well.
Yes. Now there is an age limit.
Yeah.
Yes. Yeah. So there is an age limit with it. They do start screening at age 18. So I've had some patients that, want their 14-year-old daughter screened or something like that, but they don't qualify until age 18.
Yeah. It's like we want to be proactive, but there's still an age level we've got to get to before taking those precautions. Yes. Definitely. Now, I know there's testing and being in the know. Are there any tips you can offer about maybe preventative measures? I know if it's in our genealogy, you may not be able to prevent it as much, but can you reduce the likelihood? Or are there things that you can share with us that we can do to maybe reduce that likelihood?
There are some things, and it might not be for everybody, and that's okay too, but the more pregnancies you have will also decrease your likelihood of having uterine and breast cancer. The longer you breastfeed can also decrease this. So those are two top things that can kind of lower your risk, which is part of the questionnaire as well, is how many times have you been pregnant? How many babies do you have? So, there are a lot of those things you can do if you want.
And is that because I'm curious, because I'm 35, I don't have children yet. Is having children and breastfeeding, is it because of the type of hormones that go through our body? This is more just selfishly me wanting to know now.
Yeah, I think it's just because of the cells and the way that, especially the uterine part of it, it's the way that the cells are changing during pregnancy, and that you're shedding and you're not building up cells during that time. And so obviously the more you have, the less chance you have of cells changing. More babies you have, the less chance of cells changing within the uterus. I would assume it's about this
work.
I know.
You hurry up.
You have time. But so that's kind of a neat little tip. But
yeah, okay. So when it comes to screening, what's the timeline like for getting results back? I'm often one that's really anxious. I want to know right away. What's the turnaround time for results?
Yeah, so normally it can take up to 2 weeks to get these results back. It's usually pretty quick. And so what happens is Myriad sends me basically a packet with the results. And so I really like to see my patients back to go over these good, bad, whatever they are, because I just want to make sure that, we sit down, we're able to ask any questions. Also with Myriad, they offer genetic counseling for free to any patients that have, been drawn. So they have access to that as well. So I see a lot of different genes in there that aren't necessarily linked to cancers, but sometimes they're just identified on the screening. And so those genetic counselors are available to kind of go through those gene changes as well.
Wow. Okay. So can you tell me a little bit more about the genetic counseling? I'm like extremely curious. What?
Yeah. Go ahead.
Is it almost, because when I hear counseling, I think almost like if I'm talking to my counselor, is it a similar experience almost?
Yes. Yeah. They're basically genetic counselors. So they go through the genes. And like I said, if you have a different variant, so, the most common one we hear about with breast cancer is BRCA or BRCA. There's BRCA1 and there's BRCA2. But there are a lot of other not as well-known genes that still significantly increase your chances. So they go over more of like those specific gene changes. And then the ones that I was talking about, they're labeled as variants of uncertain significance. So basically we see a change, but it's not significantly linked to a certain type of cancer. So they're just saying, hey, we do see this, but right now it's not a higher risk. And so those genetic counselors can really dive deep. That's kind of past what I know, but they really dive deep into, what this gene is and what it means and the possibilities and things like that. So,
yeah. So if I spoke with a friend of mine who is a 2-time survivor, and she shared with me the decisions that she had to make. Now, I know every decision is going to be specific to each person, but can you share with us some of the options that might be available if someone is diagnosed?
Right. So basically if a patient comes back with a higher risk gene, a lot of times what this recommends is biannual screening, imaging screening. So say in January we get a mammo, and then 6 months later it recommends an MRI. So twice a year you're having imaging, and twice a year it's recommended to see your practitioner as well to have a clinical breast exam. So basically every 6 months you're following up, because obviously early detection is key. If we have a patient that has concerns or a very high risk gene, a lot of times I'm also going to refer them to a breast oncologist and a surgeon, just so that they can go talk to them and listen about their options. Because that's the most important thing, in my opinion, is that they're educated on all of their options, and it's their decision on what they want to do. But I have patients that, want to treat things very naturally and maybe do the screenings, maybe not do the screenings. And then I've had patients that have very high risk. I mean, basically we know at some point they're going to develop cancer, breast cancer. And I've had a few patients that, they're done having babies and they know, and they just chose to have a double mastectomy.
Yeah. That's what my friend, that was the decision she made. It was only found on one side, but when they sent both off for biopsy, they found traces of cancer on the other side. So she was glad that she made that decision to do both. But even that decision in itself, she said was very difficult, a difficult decision to make. Yeah.
And none of us know what we would do in that situation, and how our families would react, and how, I can't imagine.
Yeah. Now, Meg, what's the best way to get in touch with you? We want to set up an appointment for screening, not just for breast cancer, but if I want you to be the person to care for me, how can I get in touch with you?
So you can go to my website. It's alphawomenswellness.com. And then at the top of every page is a book appointment button. And so you can basically go in there and pick, I have different appointments. So if you're wanting to come in for a wellness exam, or if you want to just come and have this screening done with me, that's totally awesome. Then you can also do that. And so, you pick there, it gives you times and dates available, and you just schedule online. But you can also reach me at my number, and I can help you schedule if you're having any difficulties or you don't see a time that really fits your needs. Then I'm open to come in at different times. So my number is 214-945-8551. So you can call or text that number too.
You'll be ringing off the hook, Meg. Better be careful.
That's my business line. Yeah.
And we'll make sure to provide links and everything for everyone so you can quickly get in touch with Meg. I appreciate your time today, Meg. I hope we can talk with you more. I know today we're focusing on breast cancer, but would love to talk more about you starting your business and your experience just winning a national championship. Would love to talk more with that. Before we leave, though, what do you want to leave everyone with? Any man or woman who's watching this that may be experiencing the journey of breast cancer or has a friend or loved one that's experiencing that journey?
I don't know. There's a lot of support out there, and you just have to find it. And it's difficult to find that sometimes. But there's a lot of different options as also. So don't hesitate to seek a second opinion. I think that's a huge thing. It's not just one way and that's it. And I think that also, if you've had a doctor you've been with for 20 years and this is happening, sometimes it's okay to get a second opinion. And so there's a lot of different options out there. So, but I know the struggle, and it's hard, and just being there to support those family members and helping them get through it. It's a tough time for everybody, not just the person with the cancer experience. And so, it's a lot. It's a lot for.
You summed it up perfectly, though. There's options out there. Don't be afraid to get a second opinion. And lastly, what I heard is you're not alone. You're not alone in this journey, and there's support for it.
Yeah, a lot of amazing people. I lost my mom to cancer last year, and I just can't even express how grateful I was to my friends and family and hospice and like everybody. It was amazing. But you're definitely not alone, and there's a lot of great support groups. And if you need help finding anybody, then I'm here. But do research, and again, there's just a lot of different options. It's not just one way to take care of it. So
thank you so much, Meg. I really appreciate your time. Thank you.
Yeah.
So much. All right,
You're
everyone. I hope you found this information helpful. Again, we'll be sharing links so you can get back in touch with Meg, schedule an appointment for screening, and we're here for you. Thanks, everybody.